Hi, this is Dr. G, your Arthro Guy, fellowship trained orthopedic surgeon specializing in your hip and knee replacement. Today we're going to talk about knee anatomy in general, as well as a knee replacement. I'm sure you've heard at this time that knee replacement in general is a lot harder than hip replacement in terms of recovery and how painful it is. And furthermore, 10 to 20% of the patients are not happy after going knee replacement. Without further ado, let's talk about knee anatomy in general. Knee joint is made out of two bones, femur and tibia. Two bones are covered by cartilage, and cartilage can accept and spits out water depending on what the pressure is. You also have a meniscus in between these two bones. You have ligaments that are outside, that are inside. You have tendons that are front and the back and from the sideway. And you have a network of vessels and nerves that passes the knee joint. So the structure itself is very complicated, and the function as well too. It has 6 degrees of motion. 1, motion, bending. 2, rotation. 3, angulation sideways. 3, sliding forward and backward. 5th, sliding sideways. And the 6th, and then finally, you have compression and stretching. And another point to talk about the knee joint is that the overall shape of it. We can take a look at the knee joint only here, but you got to look at also from a hip and an ankle point. I'm sure if you've seen people walking with bow legs and knock knees, and it's not just the disease states that cause the knock knees and bow legs. In order to understand this, you have to look at a study that was done in Belgium in 2012. A group led by Bellarmine and Victor recruited 250 healthy individuals aged from 20 to 27 and measured their knee angles. What they found was that 2/3 of the males and 80% of the females had normal straight legs, meaning that 1/3 of males and 1/5 of the females were not. 1/3 of the males and about 1/6 of the females ended up having more of a bow legs. And if they were involved in sports earlier in their teenage years, they were found to have more bow legs than others. So in summary, the knee joint is a complicated structure consisting of a cartilage, ligaments, bones, tendons, vessels, and nerves. And it has 6 degrees of motion. And overall, it's not just a straight leg. It has bow legs and knock knees that we have to replace with. How do we perform knee replacement in general? Can we replace all the functions that I mentioned about? Simply speaking, knee replacement is replacing the diseased bone with metal and plastic. Let's talk about knee replacement. Just very generally, as we go through this, there can be variations in terms of surgical techniques, but in general, we make incisions about this much, go down, retract the kneecap along with quad and patella tendon, and reach the knee joint. When we cut out these portions, the way we go about it is that for the top bone, we make 5 different planes of cut, so that metal cap can go on top of it. And it's usually a cobalt chrome. On the bottom portions of it, we make a flat cut, make a kill punch, and sometimes ream inside, so that you have titanium metal base plate that goes on top of it. And then you get a plastic that locks onto the top, so you have metal, plastic, metal component that goes like this to replicate our human anatomy in general. So how do we actually go about cutting these 5 different planes of cut and then the flat cut on the tibia to achieve anatomic function? We can perform what we call manual knee replacement that has been very successful for 30 to 40 years, as well as a robotic knee replacement that is more modern. So I'm going to tell you the difference between two in general. But stay tuned for another episode that will talk about robotic knee replacement in more details. Manual knee replacement, when we go about doing this, is that we put a rod through the femur. And from this rod, we place a jig that is set at certain degrees of cut and certain thickness of a bone cut. From this, we make a first cut on the top. And based on that, we size it and we cut 4 more cuts out of it. And for this one, for the tibia, we put the jig system that goes outside of the bone around the ankle on this portions, and put this one, and we cut perpendicular to the alignment. So after doing this many times, a lot of the surgeons are very experienced in doing this in a very precise manner in cutting what they designed to do. However, this is designed to have one system fit all. So it can be very great for a lot of the patients. So 80 to 90% of the patients can be happy with doing this. But what about 10 to 20% of the patients? Of course, the 10 to 20% of the patients might not be happy for some other reasons. You can have a complication associated with the knee replacement, or maybe the expectation does not align with what the knee replacement can give. But you also have to think about that some of the knee variations that I told you about, some patients are born with knock knees, and some patients are born with bow-legged. There have been a lot of advancements in terms of our technology to account for variations in knee anatomy. For instance, there is a navigation system, there are different ways to put the jigs around, but more recently, robotic surgery became very popular because it can account for the variations in anatomy. In robotic surgeries, the jig system is no longer valid. The cuts are made in a sort of a more customizable fashion. So we have to talk about manual versus robotic surgeries in general. I told you that the manual surgery can be very helpful for a lot of the patients. 80 to 90% of the patients are happy, and it can be done in a very precise and efficient manner. Manual surgery is usually faster. Robotic surgeries can be a little bit more time consuming, meaning that there can be a little bit more blood loss if there's more time in the operation room. Furthermore, in a manual surgery, you don't need to be dependent on the technology itself. What if the robot stops working? What if there is a technical error that comes with that? So you're assured that the system that has been working for 30, 40 years can be there when this is approached instead of doing a robotic surgeries. Finally, in robotic surgery, the surgeon has to place the 2 pins in the tibia and 2 pins in the femur, meaning that there could be additional incisions, or the incisions can be longer to accommodate these 2 pins, and there can be complications associated with that. Manual knee replacement can be great for normal patients. Patients with straight legs, patients who do not have knee variations. But if you're younger, if you're having quite a bow legs and knock knees, robotic surgeries can provide more of a customizable knee replacements that might be suitable for you. So stay tuned for a robotic surgery episode to go into more details of what the robotic surgery can provide for you. Thank you for watching my video today. Stay tuned for the next episode and leave comments if you do have any questions. Take care.